if you're worried that during cataract surgery you're going to see instruments coming towards your eyes, that's usually not what patients experience. Most people see bright lights, colors, or vague movements rather than a detailed view of what the surgeon is doing. And although you're usually awake, cataract surgery should not normally feel sharply painful. You may notice pressure, touch, water, or movement around the eye, and I'll explain what I mean by that. Because in this video, I'm going to take you through cataract surgery from your side of the operating table. What will you actually see, what you might feel, what you are likely to hear, and what happens if you suddenly need to blink, cough, or sneeze or move during the surgery. Because you're awake during most of the cataract operations, you're not watching your own operation like a film, and understanding that beforehand can make the whole experience considerably less intimidating. So, will you be awake? I would say for most routine cataract surgery, the answer is yes. Cataract surgery is usually performed under a local anesthetic. That means we numb the eye rather than putting you completely to sleep. The anesthetic may simply involve numbing eye drops. In some situations, though, we can give an injection of anesthetic around the eye. Some patients may receive a little bit of sedation, and occasionally there are reasons to use a general anesthetic. But that isn't necessary for most routine cataract surgery operations. So if you have a cataract surgery under local anesthetic, you can normally hear us, speak to us when appropriate, and you remain aware of what is going on. But the important distinction is this: being awake is not the same as feeling the operation. The purpose of the local anesthetic is to make sure that the eye is comfortable enough for the surgery. Before you go into theatre, you'll normally have drops put into the eye to enlarge the pupil. There will also be various safety checks. We make sure that we are operating on the correct patient, the correct eye, and the plan lens and the other details are correct. Once you're lying down, the anesthetic drops are then put into the eye. If an anesthetic injection is being used, the exact technique can vary. The surface is usually numb first, although you may notice some brief pressure or discomfort while the anesthetic is being given. The skin around the eye is then cleaned with antiseptic. And this is the part that sometimes can surprise patients. A sterile sheet called the drape is then placed around the eye and over part of the face. Your mouth and nose are usually not sealed. You can breathe comfortably under the drape because it's away from the mouth. Some operating theatres also provide a flow of fresh air underneath the drape. But if you suffer from significant claustrophobia or if you struggle to lie flat, it's better to tell the team before the day of surgery, because that gives us a much better opportunity to make adjustments than discovering it once you're already lying underneath the microscope. Now, one of the commonest worries I hear is what happens if I blink at exactly the wrong moment. I would say you don't have to worry about keeping your eyelids open yourself. We use a small instrument which gently keeps the eyelids apart from each other. So you don't have to spend the operation thinking, don't blink, don't blink. Your eyelids are being managed for you. Now, you may be aware that something is touching or holding the lids, but it should not normally be painful. Now, eye movement is slightly different. If you're having surgery using anesthetic drops alone, the eye can still move. Your surgeon may therefore ask you to look towards the microscope light or in a particular direction. If you've had an anesthetic block around the eye, the movement may be significantly reduced in that case. But even with topical drops, we are not expecting you to somehow transform yourself into a statue. Some small natural eye movements can occur, and we can guide you through the surgery. What we don't want is sudden unexpected movement of the eye or the head. So I think this is an important way to think about it. Your job is not to be perfectly still. Your job should really be to follow the instructions and communicate before you're going to move. Now, what will you actually see? This is the part the patients are most curious about, and it's usually difficult to imagine beforehand. Initially, you're likely to be aware of a very bright microscope light, but after that, people's experience tends to vary enormously. Some people describe a white light, others see red, blue, or yellow, or other colors. Some can see shapes, some describe movement. Sometimes people notice brightness changing during different parts of the operation. Occasionally, somebody will describe a vague shadow or object moving around. But what you generally do not have is clear high definition view of the surgeon operating inside your eye. You're not normally lying there watching a scalpel moving towards you. Much of the visual experience is simply the light, color, and movement. And I think this is worth remembering for the surgery. With cataract surgery, what patients imagine beforehand is often a lot more detailed than what they actually see. Now, different patients will describe very different experiences. So one person may tell you that they saw beautiful blue and purple lights. Somebody else might say that they mainly just saw a white light. Another person may remember very little visually at all. That doesn't necessarily mean that anything has gone wrong. There isn't a single correct way that cataract surgery is supposed to look like from the patient side. The type of anesthetic can alter what you perceive. So for example, if a person is having surgery using anesthetic drops alone, they may be more aware of bright lights and colors than somebody who's had anesthetic injection around the eye. So don't worry if your experience is different from somebody else's. Now we come to probably the biggest question, will cataract surgery hurt? Now, the aim of the anesthetic is that you should not feel sharp pain during the operation, but I think it's more useful to explain that properly rather than simply saying, no, you'll feel absolutely nothing, because that can create the wrong expectation. Now, during the surgery, you may be aware of touch. You may notice pressure, which can be uncomfortable at times. Sometimes you'll feel water running around the eye or down the side of the face. You may occasionally even feel movement around the eyelids. Now, none of these sensations necessarily mean that something is wrong. The distinction that I normally make with patients is between sensation and pain. You may have sensations, but you should not normally be sitting there experiencing significant sharp pain. And if something does hurt, do tell your surgeon. Don't simply assume I mustn't say anything because they are operating inside the eye. As surgeons, we would rather know. In most circumstances, additional local anesthetic can be given if necessary. Now, some patients are particularly worried about the eye holder itself. It does not normally feel like something forcing the eyeball open. It sits in between the lids and simply prevents you from blinking over the surgical area. Because the eye and surrounding tissues have been anesthetized, most people are aware of it only as a strange sensation or some pressure rather than pain. And once the operation is underway, most patients stop thinking about it. Now, what about sounds? You will usually be able to hear what is happening in the operating theatre. For example, you may hear the surgeon speaking, you may hear nurses talking, you may hear beeps or sounds coming from the equipment. During the common form of cataract surgery, the ultrasound energy is used to break up the cloudy lateral lens into small pieces so that it can be removed. So there may be various machine noises during different stages of the operation itself. Now, some people find it reassuring to hear the surgeon or the team talking. Others may prefer as little conversation as possible. One thing that is important to understand is that occasionally you may hear the surgical team discussing something technical. Now, that does not necessarily mean automatically that something has gone wrong. Operating theatres tend to be working clinical environments. That means, for example, in teaching hospitals in particular, surgeons may also be discussing parts of the procedure with another surgeon. So hearing a technical conversation doesn't necessarily mean that there is a problem. So can you talk during the operation? Yes, but follow the instruction of your own surgical team. We don't normally want a running conversation while we're operating because talking can move your head and your face. Um, but you absolutely do need a way to communicate. Your team, for example, may ask you to speak or raise a hand, squeeze somebody else's hand, or use another agreed signal. The exact system can vary, and this becomes particularly important if you need to, for example, cough, sneeze, move your head, adjust your back, or you're simply becoming uncomfortable. But don't suddenly sit up and don't suddenly turn your head. Instead, tell the operating team. The surgeon can then stop at an appropriate time and allow you to cough, move, and then continue safely. Now, this deserves a little bit more explanation because people generally worry about it. What if you suddenly need to cough during surgery? If you feel a cough coming, it's better to say so. You don't have to suppress a cough while becoming more and more desperate. It can be something very simple as saying, I'm going to cough. That then allows the surgeon to pause when it is safe, and then you can cough. And then after that, the surgery can carry on. Now, the same applies if you suddenly become uncomfortable or need to move. Communication is much safer than trying to tolerate something until you suddenly jerk your head. And what if you are very anxious about surgery? Being nervous before eye surgery is completely understandable. For some people, simply knowing what to expect is enough. For someone else, anxiety is a lot more significant. It's usually best to tell your surgical team. Don't feel that you need to prove that you're brave. There are different approaches that we can take depending on the individual patient and their circumstances. So sometimes reassurance and talking through the procedure is enough. Sometimes the anesthetic approach to the surgery has to be altered. In selected cases, we may opt for sedation when appropriate, and occasionally a general anesthetic is the best way forward. But these discussions have to be personalized. One thing that I've found is that unfamiliar sensations are often a lot more frightening than familiar ones. A strange blue or white light is a lot less alarming when somebody has already told you you may see a strange blue or white light. Knowing what might happen can actually make a real difference. So how long are you actually lying there for? The exact time varies according to the cataract, the eye, and the complexity of the operation. For many patients, the actual cataract procedure is measured in tens of minutes rather than hours. A routine operation, for example, may take around 20 minutes, although some are quicker than that, some are more complex and therefore can take longer. The entire hospital visit is obviously longer. There are checks to do, drops, preparation, and recovery afterwards. So don't confuse spending several hours at the hospital with having several hours of surgery. So what happens when the operation finishes? So once the new artificial lens is in position and the surgeon is happy with the eye, the instruments are removed. The eyelid holder then comes out as well. The sterile drape comes away from the face. And depending on the circumstances, the eye may be covered with a pad or a clear protective shield. Your vision may initially be quite blurry. The eye can water, things can look unusually bright. And because the cataract may have been filtering or yellowing your vision for years, some patients can actually notice that colors look very different afterwards. But I would say don't judge the final result from the first few minutes. The eye still needs time to settle down. So let me bring all of this together. What might you see during cataract surgery? So it could be bright lights, colors, shapes, changes in brightness, vague movement, usually not a detailed view of the operation itself. What might you feel? So it could be touch, pressure, water, movement around the eye, possibly some brief discomfort. But you should not normally feel significant sharp pain. And if you do tell your surgeon. And what might you hear? So it could be voices, instructions, equipment, beeping, machines or sounds, and ordinary conversations within theatre. And remember, you don't always have to keep your eyelids open yourself. You don't have to somehow remain perfectly motionless without communicating. I think one of the reasons cataract surgery can sound quite frightening is the idea of being awake while someone operates inside your eye. It's quite hard to imagine, but the patient's view of cataract surgery is very different from the surgeon's view through the microscope. From your side, usually an experience of light, color, sounds, and some unusual sensations is common, rather than a detailed view of what's happening in front of your eye. And knowing what's likely to happen, while also understanding that every patient experience is slightly different, can make the whole experience a lot less mysterious. And if you're particularly anxious, claustrophobic, or have difficulty lying flat or still during the surgery, it's best to discuss that with your surgical team beforehand so the situation can be adapted to the individual. And once you're comfortable with what the operation itself is actually like, there is another decision that matters enormously, which lens should actually go inside your eye. Rather than simply comparing a list of lens technologies. In the next video, I'm going to try and explain the questions that I think really matter when matching a cataract lens to your lifestyle, reading, driving at night, astigmatism, and how much you want to depend on glasses. I'll see you in that one.